Welcome to the Behavioral Health Best Practices Podcast. I'm your host, Dennis Streeter. On this program, we will learn about the Colorado Federation of Families for Children's Mental Health, a family-focused advocacy group to offer support for those dealing with a child's mental health issues with resources, education, and emotional support. Visiting with us today are the organization's executive director, Margie Grimsley, and board member, Libby Stoddard. Margie and Libby, thanks so much for being with me today.
Thanks for having us.
Okay. Why don't we start out by explaining a little bit of what the Colorado Federation of Families for Children's Mental Health is, some history, and kind of what you guys do. What is the Colorado Federation about?
The Colorado Federation of Families for Children's Mental Health has been around since 1993, and it was started by a group of parents and providers who knew that there needed to be more advocacy and more consumer oversight. So the Colorado Federation of Families for Children's Mental Health was formed.
I just wanted to add that we are aligned and we are affiliated with the National Federation of Families, which is, there are National Federation affiliates across the state, and they really were our guiding principle behind who we are and how we have done business all these years.
I know families really struggle initially, particularly when one of their children have develop some mental health issues. They don't necessarily know what to do, where to go, etc. And this is something the Colorado Federation would be able to help the family with, right?
Absolutely, Dennis. We provide support and education and information for parents. Let me tell you a little story about a family that I know that had a 13-year-old boy who was getting moody, and the mother would call me and say, well, he's getting so out of control. And so I gave her some resources to use, and she thought everything was getting better. She got a call from the school. Her 13-year-old son had been in a fight at lunchtime, and he had used terrible language, and the school was requesting that she come pick him up. He was going to be suspended, I believe, for 3 days, according to the school district's policy on physical altercations. She just did not know what to do or where to go. She had talked to her pediatrician's office when it had been a problem earlier with his moodiness, but she didn't really know what to do now. And so she called to see what we could do and how we could help her. What she could do to get more services for her son. She was feeling very alone and scared, as most parents would be in that situation. So we were able to help that parent find the right services, because you're right, getting the right services has been a maze in this state. And so we were able to help her get those services and get her son back on stable ground.
Offering resources to family is kind of the key to your effectiveness, isn't it, Margie?
I think it's really important to be able to offer resources. And from my experience, what works best is when we can actually link them with someone in the community which they live in. It's one thing for me if I'm in Denver trying to help someone that's in Grand Junction. So part of what we really want to do is to be able to help families connect with services and supports in their own community. But a huge part of what we also do is we're trying to impact legislation and policy that really can ensure that families and children are receiving the appropriate services and supports they need and deserve. And I just want to throw in, because this is one of our guiding principles, is following what's called system of care values and principles. And that really is that we want to work in partnership with those different systems that families come in contact with. That sometimes is juvenile justice, it's probation, it's mental health services, schools, as Libby said, but we want to be able to help families be able to connect with those in their communities that are there to help them. And if not, how can we make that happen?
So again, I would think that the ability to collaborate with a lot of agencies, other advocacy organizations, as well as treatment centers, would be key to getting the proper information to families, right?
Absolutely. We have formed partnerships with most of the child serving agencies through the years. Federation of Families for Children's Mental Health in Colorado has had what was called the System of Care Collaborative when one grant had ended. And it was made up of parents, but also a lot of different service providers. And we met monthly to talk about the things that were going on in children's mental health.
Having training so that people can be more effective is a big part, big piece in being able to effectively help families, right?
Absolutely. In fact, Federation of Families for Children's Mental Health has a training for family advocates that, if taken and followed, they can become certified in this state, but also in other states as well. We have a certification process that is international. So people certified here can go to other areas that have the same certification and automatically just be accepted and started, and then have to do the continuing education requirements. Federation of Families here, Colorado Federation, has also a training program for supervisors of family advocates, which is important to make sure that advocates are looking at the family and not just their own issues that have come up. So we've got all of that available.
So Margie, I got to know you as we both serve on the Behavioral Health Planning and Advisory Council. But as an advocate, how did you get involved in this in the first place?
No, Dennis, I was fortunate that, as I was saying, I originally came to this work because I was that individual family and we were dealing with challenges with our son. And I was fortunate that I've always am mad at myself that I can't remember the exact how I connected with this person, but her name was Phyllis Carpenter, and she was actually the founder of the Colorado Federation. And she was there and she provided me the support and then was able to connect me with others in a time when we were really struggling as a family. And I'm still here those many years later. But I think that your ultimate goal is that once you've received help and support like that, your goal is how can you then in turn help other families? And I've heard so many say that over the years. And that's always been our commitment, that the Federation is there to help families, but also at the same time, taking advantage and learning from so many of those agency and provider partners that have also helped along the way. Because our goal is not to have it be them against families here and whoever else over there. We want to really figure out how families and those providers can work together. And that's what the Federation helped me be able to do. And now I want to be able to help others do it as well.
Right. Okay. And Libby, what's your story of advocacy? How'd you get involved in all this?
Well, my story is similar to Margie's. One of my children was diagnosed with first depression when he tried to commit suicide. And he didn't actually do it, but he had a plan, and he talked to his principal about it, who called me, and then we went from there. My Phyllis Carpenter was a woman named Marty Dwyer, and my husband actually worked for her husband. And he mentioned that we were really struggling with our son, and his boss had called my wife. So I did, and she was an amazing woman who also had personal family experience with mental illness, and she provided so much support and information to me.
Now, Libby, you mentioned the fact that you guys track legislation, and that is a key element. But there is also something Colorado is kind of in the middle of, and that is there was a class action lawsuit on access to Medicaid and ongoing treatment. And you guys are really kind of on the forefront tracking how that's going. And you want to just share a little bit about what that's about?
Well, the system of care lawsuit is based on what's called EPSDT, which is a requirement in Medicaid, to provide the best services possible. And system of care has shown over the years with research that it is the most effective treatment for children with mental health challenges.
Well, we were approached because we were the family organization for the state if we wanted to be involved with the lawsuit. And I think we really have not been as involved as we originally had hoped we would be. And so basically what we have done to this point is we have taken the information that has come from healthcare policy and finance regarding what they envision a Medicaid system of care to look like, and really put our own, I would use the word expertise, but also recommendations on how what we perceive and have learned as being involved with system of care for so many years, what those actual principles, what they are, and how we see they should be overlaid in whatever Medicaid system of care is created in Colorado. So I think monitoring is a good word, but also advising would be also critically important. But as Libby mentioned with the System of Care Collaborative, no one entity or lens can do that alone. And so that's why the work that we're doing is so critically important, to ensure that we have those that provide supports and services and actual treatment to families, as well as those that are overseeing it at the state level and local levels, and actual families. We all, law enforcement, child welfare, all of those people, we all need to collectively be in partnership as we create this improved Medicaid system of care, because that's the only way we can do it, that it will really do what it is designed to do.
And by the way, one of your collaborators wrote a wonderful series of information on that lawsuit, Speak Our Minds. And you are having that as a PDF document posted on your website, so people can go there and really kind of learn a little bit more of what all the lawsuit entails. Well, Margie and Libby, thanks so much for being on today, and we look forward to that next presentation, which is going to be on the system of care that you're going to come back and do with us.
Thanks, Dennis.
Thank you.
Again, thanks to Margie and Libby for the information about the Colorado Federation of Families for Children's Mental Health, And a special thanks to the other board members for their tireless work on children's mental health that help make our communities better. Be sure to visit their website at www.cofederation.org for resource information and to link with their Facebook page where you can interact directly with the board members. Thanks for being with us for this edition of the Behavioral Health Best Practices Podcast.